Hi, I'm Dr. Howard Zucker, the doc in Docology. Only a generation ago, medicine lived inside the walls of a doctor's office or a hospital. You needed an appointment for almost anything, whether you wanted to get your blood pressure checked, EKG, blood tests, you name it. But fast forward to today, and the script truly has flipped. Watches can track your heart rhythms, rings can monitor your sleep, and these patches you put on your arm, they can actually check your glucose levels in real time. But health monitoring no longer happens once or twice a year in an exam room. It actually happens around the clock. It happens when you're working. It happens when you're walking. It even happens when you're sleeping or dreaming. And few people, physicians included, have thought more deeply about this entire revolution than Dr. Eric Topol. And he's our guest today. He's a world-renowned cardiologist, former chief of cardiology at the Cleveland Clinic, and now the director of the Scripps Research Translational Institute. He's also the best-selling author of The Patient Will See You Now, and more recently, Super Ages, an evidence-based approach to longevity. Great book. Both books, great books. And Dr. Topol, is a true pleasure to have you here on Docology to talk about this tidal wave of wearable health devices, and that they're no longer futuristic gadgets that were once in sci-fi movies, or to date myself, a TV show called The Jetsons. Yes, I'm dating myself. But they're right here on our wrists, on our fingers, and on our skin, and they're changing the way we think about health and medicine. Medicine's becoming more personalized, more accessible, and more preventable. So I thought maybe we could begin at the beginning and ask you, how did your training, your experience as a cardiologist, and later your leadership roles shape the way you think about all these issues?
Well, thanks a lot for having me and for your kind introduction. I think for me, interventional cardiology, which is where I got started when my first job was at University of Michigan working in the cath lab. And as you know, Howard, that's a very kind of tech oriented, whether it's catheters and balloons and all sorts of things, later stents and rotoblators and atherectomy device. So I kind of had a bent towards that. And then, of course, as things progressed, you could see that this digital revolution wasn't going to just spare the medical world. That was going to be kind of the next frontier. Just like right now, you see that with AI. So it was kind of being grounded in the gadgetry, always kind of trying to anticipate where the next phase of medicine was going to be.
Right. Now, the book you wrote, The Patient Will See You Now, if you look, that was a decade ago. So if you look back in time, what would you have predicted now would become reality? Are the things you would have emphasized differently in the book, or do you think that you were pretty much spot on where we were going?
Well, when I wrote that book, it was a second book. I envisioned the fact that patients would have a lot more charge and that they would be able to do the things that you just described, like using a smartwatch to monitor their heart rhythm or making diagnoses of ear infections in their children without a doctor, and on and on. And when I wrote that book, it was reviewed the day it came out of the New York Times, and the reviewer said that this is completely ridiculous. That this doctor must come from another planet. I think that's a quote. So it kind of got beaten up about trying to give patients more autonomy. At any rate, we're slowly getting there. As you say, that was a decade ago, and even prior to that, creative destruction of medicine, going digital, and going in a democratized way is going to happen fully over time. It just always takes a lot longer than it should, and there's so many people that are naysayers like that who particularly in the medical field, the reviewer was a physician. Um, they don't want to give their control up. They want the patients to still be, um, you know, uh, responding, if you will, subservient in a way to them. And that's not right. We shouldn't have that anymore. Eventually, this will be fixed, but it isn't right now still.
Oh, that's a very old school way of looking at things. I will mention that a long time ago, one of the MIT either he was president of the university. I'm trying to remember who it was who said that this is back in the 1920s or 30s. He said that one day we'll have all of our information right sitting on a table, and we'll be able to actually pull it up, and it'll be right there. And we won't have to use encyclopedias. And people laughed at him. But so it'll come to me exactly who it was. But so you never know. And then in 2019, you published Deep Medicine that focused on AI. So I wanted to ask you if you think that technology, and you also mentioned that technology should support patient care, and this is where not detract from it. So do you see like these wearable devices and AI moving us towards that vision, and how do we get there?
Yeah, well, there's many ways the paths to take AI forward and enhance humanity, which, of course, again, that was challenging the that counterintuitive assertion that technology would make medicine more human. That also didn't go over well, but I'm afraid it's going to happen. It has happened. So, for example, we've seen now in many health systems in the United States that have adopted the synthetic notes, these ambient conversations. They are saving an average 2 to 3 hours of working on records, electronic records a day. And that's just going to keep in growing in terms of gift of time for physicians so they can actually spend time with patients and not have to be looking at a screen and a keyboard picking and be a data clerk. But that's only the beginning. One thing I didn't envision, the last chapter in that book was called Deep Empathy. And I said, AI will never have empathy. Well, it's true, AI doesn't know what empathy is, right? But it's channeling it incredibly well. And so what we're looking at is that you can have a doctor that from that ambient conversation, and the AI will say, doctor, why did you interrupt, Mrs. Smith after 9 seconds? You never let her tell her story or her concerns. And we could be coached to be better empathetic doctors from an AI. Who would have guessed that? And as you know, there have been many studies now that have compared the AI versus the doctor in conversation. And the doctor usually is inferior, rated by health experts, doctors, other doctors, to the responses. So it turns out I didn't forecast that. I had that all wrong. But now with the large language models, we're seeing some things that were not predicted. And this is yet another way that will make medicine more humane. I do think someday in the years ahead, all doctors will benefit by getting critiqued by an AI coach to make them better communicators, more empathetic, more connected with their patients.
So that brings us sort of to the whole doctor patient relationship. And in many ways, I was wondering, do these devices, do they actually, they're going to change the doctor patient relationship? How do they work to its benefit or disadvantage? Because I suspect patients could just bring in reams of paper with heart rhythms and glucose curves. Does it make them more empowered, or is it just overwhelming for them?
No, I think the patients now can use current AI tools to get their data, whether it be graphically summarized or through text or whatever, whereby they must know that if they bring in reams of data, that's not going to help at all. But whether it's a plot of glucoses or blood pressures or whatever the data is, that can all be made into a screenshot or brought in. I mean, I have a lot of patients that show me on their smartphone their blood pressure results or whatever. It's all synthesized. It's all summarized, graphically colored, so it's easy to read. That's what we want: is patients to have more, be in more touch with their data. It's their data. If only they could have it all, which they only get scrape a little bit from their portals. A lot more is buried in the health system, and that it should be their rightful ownership.
Do you think it could be seamlessly pulled into the electronic record, and then AI, going back to AI, could help interpret all of that information so that you can get
Yeah,
more?
that's a
What do you
great
think?
question because health systems don't want this data,
Uh,
um, and they anything that's generated by patients, captured by patients, is considered, some kind of second, third tier, and they don't want it clogging up their IT systems or
Mhm.
whatever. This is a real problem, and that's why it would be much more ideal is that each patient had their data, all their data, because they may be, of course, most are seeing multiple healthcare providers. They have different electronic health records, and you basically need to have it all in one place. Right now, for example, sensor data or genomic data and many other data fields are homeless. They're not in the health system that the patient goes to, and the person doesn't have all their data. It's all organized, it's retrievable, interactive, and can be put to large language models. In fact, even now, large health models as of today. One of the most important papers published in AI in healthcare was today predicting in any given person all diseases, all 1,276 ICD 10 diseases for the next 20 years or more. And this was done in the UK Biobank with 400,000 participants. And then, without changing any of the model parameters, 1.9 million Danish population. So we could predict not just one disease, but multiple diseases and when in people. So we're talking about a whole different time in our life of medical providers, physicians, nurses, clinicians, that we can predict the future and change the future. Primary prevention. It's really an extraordinary time, and people don't realize that. Right now there's a backlash against AI, but there's some capabilities of AI. We couldn't do this without AI. This is something we have to get used to: is re, reaping the benefits that AI is going to bring to the future of medicine.
I mean, I'm sure there's a backlash with all of the technology that happened, and everyone said, "Oh, I'd rather just have the patient sit down with me and quietly talk to me and put the stethoscope on." And then the technologies happen and it starts to change things, and we just have to make sure we find the benefits to that. Is there a story of a patient that you had where you realized where they've come in with a lot of data and you said this is actually to their benefit, or or the opposite, where they felt overwhelmed by it, or not really?
Well, I think a lot of people get unnecessary tests. And like, for example, I see a lot of patients, they had a calcium score. I say, well, why did you get the calcium score?
You
And
know?
then now they're mentally crippled, cardiac crippled, because they have a high calcium score, which is meaningless by itself. And this is unfortunate. We have another form of prevention we need to get into, which is over testing and over medicating. So my problem is more working on that stuff. Um, it's a real challenge because this um, overcooking, overdoing things, too much testing, too many medications is really a frequent problem. It's the most common thing I see in my medical practice.
I know someone who was able to get a total body MRI, and I said, "Why are
Yeah,
you going for that?" Well, he said,
yeah,
"Oh, because it'd be good." I said, "I can guarantee you they're going to find something that may mean nothing, and then you're going to go chase yourself down a rabbit hole, and that's one of the big dangers." But then on the other side, some of the things are helpful to do, like, and that's what I was thinking about, this wearable devices. And you had mentioned, I think in one of your books, you wrote about Angelina Jolie's preventive mastectomy because she was able to look at her genetics. So in some ways, there are ways that preventive medicine could be helpful. So I was wondering, do these devices, will they be able to detect problems early enough to prevent a life-threatening condition without a blood test, just in general? So maybe
yeah. I'm
that is
glad
a
you
good.
mentioned the BRCA story
Uh,
because that's one of the few primary prevention uh, tactics we have, which is a bilateral mastectomy in someone who has the pathogenic mutations is truly primary prevention. On the other hand, doing an MRI or even the cancer screening that is evidence based, whether it be mammography, colonoscopy,
mhm.
those are all secondary prevention. They're looking for a cancer. It's not preventing it. It's just finding it, right? And so this is a real problem because we have um, advocates for total body MRI who, as you point out, they get some kind of nodule in their lung or their liver or something found. I wrote about in Super Agers. My friend Drew Kular, who's a Cornell physician and New Yorker uh,
Mm.
writer, how he got his life changed because he had this prostate nodule and he has to go in and get frequent prostate biopsies, and it's not cancer. And I've seen patients who had a collapsed lung for a lung nodule workup, a liver nodule, severe bleeding, and they brought a biopsy, and all these were negative. I mean, this is the problem, the rabbit hole you described. But we have to get primary prevention going, and we can't just have the small examples like BRCA mutations. There's so many things we can do to achieve this long talked about goal, which I think right now we have a way to get there.
And we've some of these blood tests, like the BRCA genes. I mean, we've really studied them. And we know what the information means. When you have all these little devices on, how do we know how accurate they are? Are they? I'm sure some are better than others, but how do the doctors decide which data to trust and which ones not to? Because I'm sure people go out, they look for a good device, they buy it, and then they put it on. And they say, well, this is what's going to tell me about my health.
Yeah,
How
I
do
mean,
we help?
I don't think the sensors we have today are really medical. We have physical activity steps through a smartwatch or a ring. Uh, we have sleep again, and detection of deep sleep and different phases. And so the glucose sensor, that's very helpful in people who have hard to manage glucose, but it hasn't been established yet in healthy people, even though a lot of healthy people have tried it. So no, we don't have medical sensors that wearables at this point. But um, just last week I interviewed Professor Sheena Kelly at Northwestern, and she's come up with continuous protein monitoring, just like a continuous glucose, where you could track your inflammation markers. She
Wow.
tracked interleukin 6, tumor necrosis factor. Just think any protein, you could assay continuously in real time and go to your smartphone. That would be a medical sensor if you're trying to minimize inflammation in your body because you're at risk for a particular age related diseases or inflammaging. So we don't have what I would consider medical grade sensors now. There's one that is approved recently by the FDA for blood pressure at TIA,
Mhm.
but I don't know that it does such a great, accurate job for continuous blood pressure monitoring, although we've wanted to have that for a long time. Maybe in future large scale testing, it'll prove its value, but right now, I think it's a little unclear.
I mean, some of these, your body, as doctors, we know our bodies naturally adjust and go up and down. I check my mom's blood pressure, and she's in her 90s, and I could check an hour later, and it's different. I mean, just natural. Get up, walk around. So I always wonder if you have things that are tracking minute by minute, will they feed into someone's anxiety? One of my friends and I went out for breakfast and had the glucose monitor on, and showed me like literally like 15 minutes after eating the breakfast what the glucose number was. So I always wonder how much of this feeds into anxiety and how much is helpful given our body's.
Yeah, no, that's a great question, Howard. I think they're not, these sensors are not for everybody. If you're already in a hyper anxious type, they're going to make it worse. They're not going to make it better. I can assure you of that. Now, the glucose sensor, the problem we have right now is a lot of people will have this on in certain foods, particularly carbs. And as you say, minutes later, they will see this spike. And sometimes the spike could be 180, 200, 240, and it'll get people all worried, even if they were calm types to start with. So we don't know what these mean, although we just published a big paper where we did a prospective study of this. And people who do have these spikes that last for a long time, big spikes that are lasting, not just a quick up and down, they do have a higher risk of progressing uh, from pre-diabetes to type 2 diabetes. So it may have some value in people at risk who are not, that high anxiety types to start with. But, it's the same kind of thing. If a person has insomnia and now gets a sleep sensor data, it's going to probably make him lose more sleep. So these are right sensors to use in the right people because of their risks, because of their ability to handle more data. Some people just can't handle it, and some people they really will benefit from it. There's nothing that we have in healthcare that I know of that's good or bad for all people. That's why for the last 3 decades I've been on this case for individualized medicine, and someday we'll get there too.
Personalized medicine in so many ways. I knew I had on my kids when they were babies a little oximeter on their feet, and yeah, one time, on one foot, and then on the other kids when he was a little baby, or she was a little baby on her foot. But you monitor it because as an anesthesiologist, you're always looking at saturations and things of that nature. But it could always feed into people's anxiety on those things. One other thing, people wear these monitors. I was thinking about this the other day, and a lot of times talking about sleep, people sleep with their hand right next to whether it's the Apple Watch or some of these glucose monitors. Is that dangerous to them, or is it really not that big a deal since their head's literally probably lying against some of these devices that are
Um, yeah, I don't think it really, so far, we've seen data to affect the results. Um, but if your alarms are going off, about
another
this,
story? Yeah,
that's not good. But no, I don't know that position with
makes it
a watch or a ring. For the most part, that hasn't seemed to be a problem. Yeah.
good. Yeah, I'm sure people always raise those questions as well. Back to the data for a second. I was curious, you mentioned this a little bit before. Who owns all of this data? Is it that you want the patient to have personalized medicine, but the company, the insurance companies, who owns all of this? Because I bet you the insurance company would probably say, I could use that data to determine what I want to do with X person or Y person about risk. And so I wondered, how do we work through that?
Yeah. Well, this should all be seamlessly deposited in the person's health um, secure platform, but it isn't. So it depends. Like, if you're using an Apple Watch and you're collecting data about, various things, including your heart rhythm, um, but also, your physical activity and your sleep,
Mm,
Apple's done a pretty reasonable job that they don't sell that to anybody, which they could, right? I mean, if they didn't,
sure.
uh, I mean, this data has value for people that are trying to, you know, uh, sell, whether it's drugs or devices or whatever, right? So across the board, I don't know the privacy standards, although we know lots of data that, for example, your searches and all sorts of other digital uh, crumbs that you leave behind, cookies, they're used, brokered to all sorts of companies. So this is a problem. The data should not be available for companies to sell. And, health data is often very sensitive. Um, and we have a problem in this country is that it's not protected like it should be overall. And our bigger problem is it shouldn't just be our sensor data, all of our data, our images, our labs, our records should all be in the person's domain. And as it turns out, in the era that we're headed to with AI, that's even more important because if you want to know your future story of health, you need all that data to get the maximum inputs to make it maximally accurate. So we're at a disadvantage where other countries, particularly in Europe, they are giving the patient has all their data, has copies of their scans, has with slides if they have pathology labs, and they have created, like for example, in Estonia and in Switzerland, other places, to have all their data in one place, and they can share it. Whether it's a research project or a particular physician specialist, they can share what they want. It's all easy to do. That's the way we should have it, and we don't, and it's very frustrating.
I lived in Switzerland. I remember talking to my Swiss friends where they just sort of they own it. It's
Yeah,
theirs. And
yeah.
and and so how do we do that? I mean, I'm sure this involves both the companies, but also Congress and others to sort of push this issue. I remember talking to Francis Collins when I was at HHS, and we were talking about genetic privacy.
Yeah.
And who owns that? This was when the whole Human Genome Project was happening, and to make sure that that is something that we protect so that people aren't finding out whether someone's at risk for a disease 20 years down the road, particularly some of the insurance companies on
And
that
that's
issue.
still a problem today because the protection from the GINA bill is only partial. So if you're trying to get disability insurance, for example, it isn't protected, and you could have a pathogenic mutation, and now you can't get insurance. So you don't want your genomic data in the medical record. If you do a genome sequencing or if you do polygenic risk score, it has to be yours and not in the health system because it can be used against you. We don't have adequate protection. Um, the only congressional act that it took many years to get passed is incomplete for protection.
Uh, you almost want someone to have a card where you could just slip your card. And I thought about this a long time ago. I was in training. Just slip your card in because I remember when I was a peds resident, people would go to parents would take their kids to different emergency rooms, and then you'd say, "Well, what happened at that other hospital?" And you say, "Well, I've got to go call them." And I said, "Wouldn't it be great if someone just had a card and all of their information was there, and they put it into the computer?" This was obviously at Hopkins, where at the same time you were there. And I remember we used to have this computer with a little pen that you had to touch, and I said, "Why couldn't you just put that in the card in and have all of your data? That would have been an easier way to."
Oh
Track
yeah,
some.
I mean, we'll get there again someday. I remember talking to a bipartisan group of Congress, where hundreds of people from both sides of the aisle were there, and I made a pitch for this because it was a big part of that book you mentioned, "The Patient Will See You Now," and they were gung ho. We got to do this. That was 10 years ago.
10 years ago. Yeah.
Nothing has been done. Nothing.
Oh,
Yeah.
because someone needs to champion, just take it in Congress and run with that issue. That would be really helpful. With all the AI, I'm just thinking about this. With all the AI, won't we be able to pick up more of these rare diseases? I had David Feigenbaum from Penn on about Castleman's disease. And I was saying to myself, if we had data from around the world or a lot of information, we'd probably be able to pick these things up a little bit earlier and the therapies a little bit earlier. So maybe that will be an advantage to AI with all of these devices that people wear
Yeah,
as
I
well.
mean, accuracy in diagnosis is not very high in U.S. medicine. We have 12 million diagnostic errors a year. We have about 800,000 people who have disability or die because of these diagnostic errors. I think we can do better, yes. And I already we're seeing some of the effects. And you're bringing up yet another one, which is if you have comprehensive data on a person, that gives you a lot more anchoring for making diagnoses, whether it be rare or things that are missed, just makes it more accurate. Yeah.
I was thinking that the UN General Assembly is this week, and on their health agenda, one of the issues is hypertension on the global stage. So I was wondering, maybe that would be a great parameter that we should be pushing on the global public health front, as a way to track data. And if people could do that, probably could save a lot of lives in not only the United States but just around the world. As
Yeah, hypertension is probably the most common chronic disease of man, especially with aging. And yeah, getting on top of that and not overdoing it, which is another problem. So making the diagnosis and then getting really good management, that's a critical thing, and we're not so good at that. So yeah, definitely. But we
I'm
don't
what
have a continuous blood pressure monitor yet. And
right.
so, just last week, Apple said, oh, we on the new smartwatch algorithm, we can tell you if you have blood pressure that's high over the course of a month that, you likely have hypertension. That's really, okay, so what? I mean, most people should have a blood pressure device at home. They're inexpensive, accurate, like you measure it, and ideally you measure it not once a year or once a month, so that they know that they don't have high blood pressure. And the best time, of course, is to measure it when you're stressed, because then you're getting the worst case scenario. And that's what you're bringing up is there's so much underdiagnosing of hypertension, and then also inadequate management of the blood pressure. And this would not only save lives, but it would reduce strokes, reduce other cardiovascular events. So yeah, we can do better there for sure.
Yeah, I'm so glad you say that because a lot of times people say, "Well, I took my blood pressure, I calmed, I laid down for 15 minutes," and I always say, "Well, why would you do that? You really, really want to see what happens to you when you're stressed. How's your body responding to it? Of
Yeah.
course, if you lie down." I'm glad you mentioned that. As a
You
cardiologist, to
know,
cardiologist.
I think people miss it. It's just like the white coat syndrome of going to see the doctor that you want the worst values. You don't want the one where you started meditating and,
Yeah, yeah.
you were in another zone. No, you need the worst ones to know if you have it controlled.
Yeah, exactly, exactly. What do you think about some of these devices that could pick up mental health challenges or early onset cognitive issues? Do you think there'll be something there as well on devices that we could use, whether
Well,
it's
we need them because, as you know well, we don't have adequate professional support for the profound, the mental health uh, epidemic in so many respects. It's overriding any matchup of who we can to help these folks. So, if it can put a dent in that and provide at least some support, that I think we still have to see. I had a chapter about mental health, how important it is, and how promising it is in superagers, and so we're we're pretty good at seeing how chatbots can help with stress and anxiety. We're still in the early stages about depression. So if we can get AI to help support people so they're not depressed without medications, and use things like exercise, which has been shown to be better than SSRI drugs that are in common use for depression. So we have to get this on track because the interplay between mental and physical health is so deep, and we're not doing a good job on mental health at all.
I sometimes think about the body like a car. Cars from like 50, 60 years ago, the oil leaked, and ultimately you saw the oil on the ground. And you say, "Oh, I got an oil problem." And now there's so much technology to tell you what's going on with your tires, your oil. And I almost feel like the same with the body. If we could pick these things up early, long before the tire is flat, long before the engine's been affected, it's all for the better. And so
Oh
I
yeah,
wonder.
yeah. I mean, when I wrote today about this new year of primary prevention. And in fact, we have now these organ clocks. So just like you were talking about the car, where you have every component of the car you're tracking electronically, we now have organ clocks where I can see the pace of aging of your brain, your immune system, your heart, your arteries, your liver, and on and on. So the point is that we can detect in a person if there's one key tissue that's acting up, that's got probably whether it's inflammation or because your immune system is dysregulated. This is really exciting. And
How
we've
is
had
that?
multiple groups that have confirmed this. It's not like just the one group that started it at Stanford. It's now, groups all around the world that have validated that this is big, really, really important. And it goes right into your metaphor about the car.
How does that work? Tell me a little bit more. How does that work?
Yeah, so from a single small
Yeah.
tube of blood, you get thousands of plasma proteins analyzed, and they each partition these proteins into each of these organs, or in the case of the immune system. And so then you compare the pace of aging from the proteins, hundreds of proteins for each of the organs, with your actual age. And I say, oh, well, everything looks really good, but your heart pace of aging is much faster than and abnormal compared to the rest of your body. So we're going to start to look deeper into your heart story. So this is a whole new thing we've never had before. This is really extraordinary.
So wellness versus treating the disease, but trying to basically address wellness up front and preventing a
Yeah,
problem from occurring.
Pre-
Wow. Where do you think we'll be?
preserving wellness.
uh,
Yeah, or the term wellness is kind of very, it's misused a lot. But preserving human health, keeping them from having age-related or any diseases that are important. This is a new. We've never done this, but we can now. We have to go after it.
So where will we be in like 10 or 20 years from now with all of this, with the sensors, with the AI? I mean, it almost sounds like these sensors will tie in some information. The AI will look at it. Some of these early detectors will be there, and then it'll all come together and end up in the doctor's office, or just somehow the patient will also be recognizing as well. But where do you think we'll be in 20 years?
Well, and I think the themes that we've been talking about, the patients will have a lot more charge. They will, it's inevitable, have all their data. Um, and the role of the physician will be different. It's going to be truly caring, the humanistic side of what the essence of medicine, listening, having a presence, developing the trust in that relationship. But the patients and the AI are going to have much more um, uh, processing of data, and guidance and helping with diagnoses, helping synthesize all of a person's data, whether it's for the clinician or for the patient. But that all these things are going to happen. They just take too long because of all the resistance. Medicine is kind of a sclerotic, uh, ossified community, doesn't like change. But yeah, we'll get there eventually. And
Even
we'll have much
doctors.
more, much higher level of accuracy, much more primary prevention, much more autonomy of patients. But it's going to also mean embracing AI and debugging the problems that we are confronted with AI. Yeah.
I mean, even the doctors as a group, sort of, we have our own language and everything. Is there's a sort of a wall that's created? Well, these are the patients, these are the
Yeah.
health
Yeah.
providers, the doctors, and so with the internet, with everything else, that wall has slowly, it hasn't eroded. It's just a little more porous, so that people can go back and forth a little bit more. What do you think will happen with disparities? I mean, a lot of this stuff initially will be costly, but will we end up seeing more disparities between those who have and those who do not have when all these devices are out there? I mean, even the devices we have now are expensive. And so, how do we prevent that from happening?
Yeah, well, again, I wrote about this in Super
Yeah.
Agers that if we don't have it for all people, then what good is it really? If we're only catering to the affluent, that isn't going to move the needle here for promoting human health in a meaningful way. So, in many cases, these things are very inexpensive. AI is software, it doesn't have to be expensive. Um, a lot of these things we're talking about are not expensive. Polygenic risk score, you can do it, you should be able to do it for less than $25. Has immense value across all the common diseases, with years and years and millions of people that's been studied of diverse backgrounds. Um, but each of the things that we've touched on here, the sensors, the software, the genetics, these are not expensive items. And in many cases, it would behoove us to give people who can afford them, to give people to do this for nothing. Because if it
Saves money.
helps prevent their visits to the emergency room, even one night in a hospital, if it just prevents one night in a hospital, we're saving money. Thousands and thousands of dollars you could prevent one night in the hospital by giving a person who's indigent a smartphone with 2 years of data plan. And you're still, if you prevent that hospitalization for one day, it's a bargain. So why aren't we doing things like that? Yeah.
Yeah. Yeah, I think sometimes we're too nearsighted on these issues. I mean, just like oximeters. I remember when I started in anesthesia, those devices were like $5,000, and they were heavy, and you barely could get one. And now you go into the pharmacy, pick one up, and I have one in my car, one in the drawer right here. I keep one at my mom's apartment just because it gives you so much information if you know how to use it. Not just the numbers, but just looking at the rhythm, the pulsations. So I think that it would be great to make sure people have access to things that are relatively cheap. Even some of the EKG monitors that you could do at home. I mean, this is what I was saying
Yeah,
before.
you are right. There are two sensors that are medicalized, oximetry, and of course you can get that now through the Ring or for the smartphone,
Mhm.
uh, um, smartwatch, I should say, and it's pretty accurate to help diagnose if you have sleep apnea, and if it's managed sleep apnea well. And you're right about the ECG, not just a smartwatch, but fingertip sensors to give you even 6 leads of a cardiogram, which you could impute to 12 leads, as we've shown. But yeah, so these are sensors that are, again, these are inexpensive. They're already either embedded in the watch that you might have, or you can buy them separately. So yeah, these are definitely taking us forward for sure.
I think. We're going to turn to our subscribers for some questions that they may have. But first, what are some takeaways? What would be three takeaways that you think we should all remember on this?
Well, I mean, I think the one that I'm most excited about right now, and which was the theme of super agers, is that we're all going to age. That we're not going to reverse aging in a big way, or if we do, that might be very risky. But we could age in a healthy way to not have cancer, cardiovascular disease, or neurodegenerative disease. And that's what we should be going after right now. And I'm convinced that we're going to do this, that we have the tools to do that. And I really elaborated that both in the book and then a new Substack today about the dawn of primary prevention in medicine, which has been a fantasy for, since the beginning of medicine. But I think it can be realized now. The second thing would be that AI is going to be a big factor in the future of medicine. It will be the biggest transformative uh, impact of anything in the history of medicine. Uh, we have work to do to validate it, but I remain optimistic that eventually we'll get it right and it will make a big difference to promote accuracy, the patient doctor relationship, and it will be essential to the first goal of the primary prevention. The third thing would be that we need to get this patient doctor relationship to be far better. Right now, doctors are not have enough time with patients. They are, very overwhelmed and spending too much of their time doing data clerk work. They don't even get to have face to face eye contact with patients. This is pitiful. And
Yeah.
you need to have a presence and a trust and the intimacy of that relationship reestablished. I do think that will happen over time. It can't get worse. And I think, again, technology, patient autonomy, the gift of time, these things are going to help get us there.
So basically, use technology to our benefit and to the advantage of both improving the patient-doctor relationship, improving the data we get, and improving the ability to detect things early and address primary prevention as we move forward. So, and
Yeah,
use it as our friend, as our colleague. That's not another person, but a colleague to us.
right.
For
And
right,
remember, we don't want to just detect diseases, we want to detect risk to prevent the diseases. We got to get out of this mindset of finding the disease, but in
yeah.
fact, instead, promoting and prolonging healthy aging.
Absolutely, I 100% agree on that. We're going to turn to our subscribers because I know they probably have questions, and at this point, we turn to them. Kat's going to pull them up. I always mention at this point that it is important for people who are listening that if you have a medical question, you should really talk to your doctor. They know your medical history. They know what's going on. The information we provide in the podcast is for information, and it's great. But don't forget, they are the person who can manage your care the best. So, Kat, who do we have? What's up?
I'm always the first to ask a
Oh, you
question.
are always.
But I actually, Dr. Topol, I was talking to my parents and telling them that we were doing this episode, and my mom's a dialysis nurse. And so I have one question from my mother, and then I have another question from the chat for a person who can't come off camera. But we were discussing something that you kind of touched on a little bit earlier. But in terms of, oops, sorry, in terms of there's a little bit of mistrust, right, with sort of lots of things in terms of the public health and healthcare in general, and then also just like technology and AI. And so I'm curious your thoughts on wearable devices that people are using and they, get a different result when they go to the doctor's office and the the data sort of contradicts itself and how that then could evolve into more mistrust. And I'm just curious on your thoughts on whether that might end up replacing doctor's visits at some point. There's a lot there, but it just felt like the string of thoughts kept going, and there's lots
Well, yeah,
just right
that's
now.
a tough one to fully unpack. I mean, I think we have to remember that the visit to the doctor, when it occurs, is one snapshot in time, which is a very scant amount of data as compared to a person in their real world, in their own life. And so, like for example, I'll see somebody who comes in and their blood pressure is very high during a visit, and all their readings at home are really low or controlled. And I say, well, now what do we do? So, that this we have to try to figure it out. This isn't a problem with AI. This isn't about trust. It's just that a much more panoramic view of a patient is in their real world. And as we were talking about, we have increasingly and while more sensors and ability to capture that data. And the capturing the data, for the most part, for devices that have gone through FDA review, is pretty good. I mean, if you see atrial fibrillation and you can send that recording to your doctor and verify it, that sort of thing. So I don't know that the AI here is the problem. Um, there are other problems with AI, but the trust is a problem, and a lot of the anti-science that's going on right now, and the fact that there's no medical experts. Well, I think there are lots of medical experts. The problem is that we are undermining their trust. Not we, but people are. And that's really unfortunate because you don't know who to believe. Um, this is a time I just had, in the Super Agers book, I had 14 fraudulent books with my name on the cover published by AI being sold on Amazon. And I can't even get them off. And it was recently on the front page of the New York Times about the doctors that are getting fraudulently.
I did
Uh,
see that. Yes.
and also my friend Sanjay Gupta, there's an hour video of him talking to Anderson Cooper and also on his own promoting this new Alzheimer's cure. And it's not Sanjay Gupta, it's an AI deepfake video of him and Anderson
And
Cooper. And I
Anderson
just
Cooper.
had a friend of mine call me yesterday to say he just bought $850 of this and recommended it to all his friends. And Sanjay Gupta, back in July, put out in all the social media that this is not me. Don't fall for this scam. So we have a mistrust problem, Kat. It's big, but it isn't. You know, it's using AI for nefarious purposes, and there's no way for people to tell. This is an intelligent guy that's recommended to get this false, Alzheimer's cure and prevention. I mean, it's sick. It's very disturbing.
Wow, that is very scary. That is really scary. They should find who did it, and that's where the law should come in and say,
Yeah,
this
yeah.
is this is as dangerous as anything else, and then make people afraid to do it. Although someone will try to find a way around it, but that's very concerning because
Yeah, I mean, look, Gupta put this out, Dr. Gupta, in July 31st, and here it is this week, and these people are still falling for it left and right, and we're well into September, so if nothing has been done to stop it, it just keeps proliferating.
and he picked it up. He knew, but there could be some doctor in the middle of the United States where someone does this in their community. And the next thing you know, people are sort of believing someone. And next thing you know, his whole practice gets.
Oh yeah, no, and if you look at it, you would say, "Oh, that's him. He's saying all this stuff," and that's Anderson Cooper. He's saying all this stuff because you
Wow.
can't tell, especially if you're not suspicious.
Yeah.
Goodness. That is
Thank Ed. Yeah.
I do have one more question, but I'm asking it for the person who cannot be on camera. The question is, what would you say to someone who could benefit from the use of one of these devices or monitors, that is concerned about radiation?
Well, none of these that we talked about have any radiation,
Mhm.
so that's good. That's one good thing. Yeah, I, I would want people to avoid radiation.
Mhm.
So don't get these tests that, whether it's a CT scan, a PET scan, all these tests that have lots of radiation, they should ideally be avoided if you can. Yeah, radiation. We don't have enough respect for that, and doctors use it too broadly, and It's a risk for cancer cumulatively as you get more and more radiation, particularly the high doses that you can get through medical imaging.
Yeah, totally understood. Thank
Yeah.
you.
Thank
I had answered
this.
this question.
You have another one, or good?
Yeah, there's one more question I'm going to
Anna?
bring up
Great.
on.
Hi.
Yeah, Anna. Yeah.
Hi. Can y'all hear me? Hi, Dr.
Uh,
Zucker. Hi, Dr. Topol.
Hi.
Nice to meet you. Um, what a fascinating episode today. My question for you is, how do you see continuous monitoring evolving beyond the wrist? I know I've seen also like rings, but also like, for example, implantables or smart textiles. I think I heard you say ambient sensors, but kind of what do you kind of see these, how do you see these evolving?
Yeah, I think they will continue to evolve. I mentioned the one I think I'm most excited about is continuous protein markers. So you'd have continuous inflammation readout on your phone about your body, and that's a risk factor for all the major age-related diseases. And that'll tell you whether your diet's good, because if it's really good, it's going to help bring down inflammation. It'll tell you if you're exercising a lot, because again, it brings it down, and also about your sleep health. So that one I think is in the works. But what we have today, we have really good sleep health sensors. I every day I use three. I have a ring, I have a watch, and a mattress sensor. But the ring is, in my view, the most accurate. Um, but I compare them just out of kicks because I've been doing this for a year now. I want to get the most deep sleep I can because that's where my lymphatics of the brain clear out all this metabolic waste each day that otherwise, if it doesn't get cleared out, is pro-inflammatory in the brain. We don't want that. So they're pretty good right now. They're as good as a sleep lab, particularly the ones that are most accurate, and that's been compared back to back, or whatever. So we'll see better. I hope we'll get someday a blood pressure continuous monitor that we can trust, because not that we should have it on all the time or a glucose monitor all the time, but it helps in certain time, if it's for a week or a month, because you want to know what your blood pressure is doing when you're under stress. And most people, when they're under stress, the last thing you're going to do is go get a cuff and put it on, right?
Right.
So, we do need better sensors for the important common diseases like diabetes or risk of diabetes and blood pressure, for sure. But I think sensors are going to keep, zooming forward. That's the way I see it. And the big thing is that we'll see AI be able to integrate that data, which is very challenging because it's so much data. I mean, the glucose sensors every 5 minutes, and other sensors are every minute. So this is a challenge for analytics, and no human could do this without the help of analytic support.
Absolutely. That's it. That's a great answer. Thank you.
Thank you. This has been a great conversation. I could talk for another hour with you and about all these different issues, because not only just the data and the watches and devices, but as you were talking about with the AI issue of how this all feeds together, and how we are going to see literally we're seeing a revolution in medicine and technology, and how it all comes together. But the umbrella issue of improving the doctor-patient relationship as we move forward with all of this. I'll put the pitch in for Super Ages because it's a great book, and I think that everyone should read it. And the podcast, my Docology podcast, is all about being the antidote to all the confusion that's out there. And there is a lot of confusion. That's what we're trying to address, and make sure people hear the data and understand it. The consumer who's looking at products to try to buy, and the consumer who wants to get as much information, because everyone's worried. People worry about their health. It's very personal, and they want to be sure that they're not doing something to harm themselves, anyone they love, friends and family. So I want to thank you for giving us a glimpse into the future, a glimpse into exactly what's going on. This is just great. I know people could read more about what you've written about all of this, and we're going to track and see where we are, and we're going to bring you back on at some point, and I'd love to be able to sit down at some point in person, and in 5 years from now say, hey, is this where we are? Did we see this coming? But thank you very much, and looking forward to talking to you more. That's our show for today. But remember, if you're a Docology subscriber, you can join the conversation. Just sign up for our email reminders about the upcoming episodes. You could do that on docology.life or on Substack. And don't forget to click like and subscribe. So please tune in next time, because the topic we cover may just save your life. Docology is a production of Hang Media. Our producer is Catherine Warren. Ronnie Selig is editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracoli. Theme music was composed by Nick Kitts. Subscribe and join our community at docology.life. Until next time, move, wash your hands, and stay healthy.